So the reason why I'm actually doing this live session is because when I was preparing for my OSCE, or when I was looking forward to getting myself ready for the exam, I wished I had someone who would be on live session like this, or who would at least give me an overview of what I should be expecting for the exam. And because I couldn't get any, I think I waited far too long because I anticipated so many things for the exam. But clearly, if I'd gotten someone like what I'm doing at the moment, I think it would have just given me that confidence for me to go for the exam quickly. I waited for far too long, but it wasn't late. So this is being done so that at least if you're also thinking that is it even okay for me to begin my OSCE exam process, or for me to begin my NMC registration process, this is the right space that you need to be, because I will tell you for free that yes, do not wait any further. Just get your registration done ASAP. Create your account. After creating your account, upload all the documents that they are requesting from you, and then wait for them to give you the go ahead to prepare for the exam. And for the exam, we are here to guide you so that you can go and then pass on your first attempt. Don't forget that the test of competence is in two parts, the OSCE and then the CBT. Today, we are mainly focusing on the OSCE. Some time ago, we did the CBT, which we still have the recorded session on YouTube Live here. And every now and then, I get at least not less than 3 individuals coming back to say that, oh, after watching your videos, I've been able to go and pass on my first attempt. So this is also going to be another session where you can also watch this, have an overview, know how to prepare for your OSCE, and then you can fully go and then pass your OSCE on your first attempt. So what's the time? We're giving ourselves the next 4 minutes, and when it's exactly 45, we are going to begin a live session. We are going to begin with our training. So if you have any questions at all, you can request to ask on the TikTok live session, or you can join me on YouTube and then type it in the comment section. It's all about the UK NMC OSCE exam. We are making sure that we give everyone who has joined the live session an overview or an idea or an insight into what they should expect on the OSCE day. And for those who are also preparing, know some tips that you can also apply to your preparation. Those who are yet to also begin their registration process at all, also be encouraged and be motivated to begin your process. That is the main reason why we are gathered here today. So in the next few minutes, I'm going to begin, and then we will look into every step or every stage of the UK NMC OSCE exam. Whether you are, please, that's the CBT and OSCE have time limits. All right, so in terms of time limits, when you write the CBT and you pass on your first attempt, or when you write the OSCE and you pass on your first attempt, you need to write the other exam within 2 years. So let's say you write your CBT now, you have the next 2 years. So let's say today is 31st of July, you have 31st of July 2028 to write your OSCE. But if you wait and then 2 years is gone or 2 years has passed, you would need to go back and write the CBT, even though you've done your OSCE and passed. So make sure that once you write your CBT, you do your OSCE in addition, that is within 2 years. I hope it makes sense. So CBT has got 2 years, OSCE has got 2 years. Okay, great. Are there any other questions from anyone? We have 1 minute to begin. We have 1 minute to begin. Right, so when I begin, if there are any questions, I would be happy to answer them in between. But then I would have to present a few things, and then later I will then pick the questions and then answer them. But as I'm presenting, if you have any questions, you can just type it in the comment section. Right, so our time is up. Let's begin. Welcome to this live OSCE session. It's a free seminar or workshop, if you can call it like that. We are going to look at the expectations for the UK NMC OSCE exam, right from knowing what it entails in all the OSCE stations, and then what is even meant by the word stations, and then how do I begin to prepare, and where do I even get the documents for me to use to prepare for the OSCE exam. So if you have joined me on YouTube, you're warmly welcome. If you have joined me on TikTok, you're also welcome. If you have any questions, please drop it in the comment section. I'll take it up and then answer them for you. But for now, just for you to know, the UK NMC requires every international applicant or overseas nurse, midwife, mental health nurse, that before you can join their register, you need to sit for 2 sets of exams. You need to sit for 2 sets of exams. And the first exam, or one of the exam, is called the CBT, is computer-based test. And to give you an overview what the CBT is about, the CBT is to test your knowledge on drug calculations. So the CBT has got 2 parts. We have part A and then we have the part B. Part A, like I said, has got to do with drug calculations, know how to calculate drugs, whether the patient is an infant, whether the patient has got this body weight, or whether the patient has got this particular condition. How do you give this amount of volume, or how do you know the number of tablets that we need to give to our patients? That is the part A. You have 30 minutes to answer 15 questions. Now for the part B, that is 100 questions. For the 100 questions, it is all theory, objective test. So you are going to select from the options that you'll be given, and you have 2.5 hours to answer 100 questions. Now, just as someone asked, you need to pass this CBT on your 3rd attempt. So if you go and sit for the 1st attempt and you're unable to pass, you have an opportunity to sit for the 2nd attempt. And if you go on your 2nd attempt and you don't pass, you need to go for the 3rd attempt. And so that is the 3 chances that you have to pass your CBT. If you fail to pass on your 3rd attempt, you need to begin your registration process all over again. Now, the same thing for the OSCE. The OSCE, the full meaning is Objective Structured Clinical Examination. Right. So just as someone has stated, now the part B is currently 110 questions. There's no more 100 questions. I've not seen the update yet. Thank you for bringing it up. So it is 110 questions. Right, so for the parts, okay, and now the part A is 17 questions. All right, so we will find out later and then update ourselves. Oh, okay. Interesting. So now it's been confirmed, or some people are also saying that yes, indeed. Part A is 17 questions, and then part B is 110 questions. Good. Now moving on to the OSCE. The OSCE, like I said, is Objective Structured Clinical Examination. And for this type of exam, you need to perform a skill with an assessor who is going to observe you as you perform the skill. So the assessor is going to be with you in a small room, which is going to be the examination center. And so in there, the assessor is going to prepare the particular station or the particular task that you need to accomplish. And then the assessor is going to observe you as you carry out that task. And they will have the marking criteria with them. And so they expect you to do every step on the marking criteria. And after that, they will now determine whether you were able to finish every step on the marking criteria within the time that has been allocated for that particular station. So simply, this is what the OSCE is about. Now, don't forget that the OSCE is not an advanced form of skill. It is just the normal entry level skills that you and I have been practicing all these years. So examples include giving IM injection, passing NG tube, maybe giving suppository medication. We will be looking at those later. But just for you to know, those are the skills that you're going to be assessed on the day of your OSCE exam. So it is not advanced form of skill. So now this is how the OSCE is going to be like on the day that you attend your OSCE exam. So when you go, the assessor is going to invite you into where you are going to be assessed. And they will let you know that we are going to use this number of hours for all the stations that you need to cover. You are going to be assessed on 10 stations. You are going to be assessed on 10 stations. So I'll be sharing some few things on YouTube shortly, but you're going to be assessed on 10 stations. So whether you are a midwife, you're going to be assessed on 10 stations. Whether you are a nursing associate, you're going to be assessed on 10 stations. Whether you are mental health nurse, you're going to be assessed on 10 stations. And then whether you are joining as adult nurse, you're also going to be assessed on 10 stations. Now, someone who is going to be asking, so how do I know the 10 stations? Unfortunately, you would not know the 10 stations, especially for adult nursing, mental health nursing, midwifery. You would not know the 10 stations until you've gotten there to do your OSCE. But for nursing associates, it is good, and I'm happy to share with you that for you, you can anticipate what you will be doing for the 10 stations. You can anticipate what you will be doing for the 10 stations. So quickly, the 10 stations, let's break them down. So if you've got any pen with you, if you've got any pen with you and you're making notes, let's break the 10 stations down. I'm hoping to be able to carry everyone along so that we don't get lost in the middle somewhere. I'm hoping to carry everyone along. So with the 10 stations, we are going to divide the 10 stations into 4. We're going to divide the 10 stations into 4. So we can just write 1, 2, 3, 4. Just number 1, 2, 3, 4. And then leave a space. And then write 5, 6, 7, and 8. 1, 2, 3, 4. And then 5, 6, 7, 8. And then leave a space again. And then write 9. And then leave a space and then write 10. So let's say the numbers that we've written down, those are going to be the 10 stations we will be assessed. There's going to be a slight change with the nursing associates, but let's stick to what we've numbered. 1, 2, 3, 4, leave a space. 4, 5, 6, 7, 8, leave a space. 9, leave a space, and then 10, leave a space. Now for 1, 2, 3, 4, write A for number 1, letter A for number 1, And then number 2, write P. For number 1, write A. Number 2, write P. Number 3, write I. And then number 4, write E. Those on YouTube, I hope you are following. Thank you. Right. So 1 is A, 2 is P, 3 is I, and then 4 is E. Now let's leave 5, 6, 7, 8. And now let's get to 9, 10. It will come back to 5, 6, 7, 8. For 9, write professional values in full. Professional values in full. For 9, write professional values in full. And then for 10, write evidence-based practice. For 10, write evidence-based practice. Good. So now I know on TikTok and on YouTube, you have seen the comments. So 1 is A, 2 is P, 3 is I, 4 is E. And then we've left 5, 6, 7, 8 intentionally. And we've jumped to 9, which is professional values, and then 10, which is evidence-based practice. Good. So now let's look at the first, or number 1, the A, the full meaning, or what we intend to understand is that it is assessment. So A is assessment. So write A in full, assessment. A is assessment, and then the P is planning. That is the number 2. And number 3, the I is implementation. And then the E is evaluation, which is the number 4. Great. So I believe that you can see in the comment section, number 1, which is the A is assessment, number 2 is planning, number 3 is implementation, and then the number 4 is evaluation. Now for these 4 stations, the first 4 stations, mostly you're going to hear the word API. Mostly you're going to hear the word API. API. So that's the short form for assessment, planning, implementation, and then evaluation. Great. I hope everyone is following. If you are following, please type yes in the comment section. If you are following, type yes in the comment section. Good. Great. So now let's look at the individual health specialties and then what they need to understand or what they should be expecting for the API and then for the professional values and then evidence-based practice. Now, to give you an overview of what the API means or what the first 4 station means, let's take a patient's clinical pathway as an example. When you and I, when we go to the hospital, we first go for our folder, and then we need to be assessed at the OPD by a nurse, and then we need to now go and see the doctor or the GP. Now, after seeing the doctor, if the doctor assesses you and then determines that, no, let's admit this patient, what's going to happen is that you will be taken to the particular ward that you need to be admitted. Now, the nurse who is going to admit you will have to do assessments on you. So that is the A. They will have to do assessments on you. That is the A. And so after assessing you, they will now say that, okay, I have assessed this patient. We are going to admit this patient based on the doctor's instructions. And during your assessment, you'd realize that the patient is showing some concerns, or they will have some complaints that they will report to you, or you are going to identify. And so when you are admitting your patient, you are doing your assessment, and you've identified some complaints, that will lead you into the planning. Now you need to find a way to write a nursing care plan on how you are going to help the patient, or how you're going to assist the patient to relieve them of that complaint. So let's say when you're doing your assessment, you realize that the patient is in pain. So pain will be one of the complaints. And so you need to write a nursing care plan. So that will lead us into P, which is planning. So you need to plan 2 complaints or 2 problems that your patient is going to tell you, or you are going to identify for your patient. The next one is going to be I, which is implementation. Now, after admitting your patient, after you've done your assessment, you've identified the complaints. Now, the next thing is that patient is now on the ward, and you need to now begin to administer medications. So the medications that is maybe going to help your patients to reduce the pain that you've identified in the planning, that is what you're going to do under the implementation. I hope we are all following. So implementation is basically administer oral medications. So implementation is basically administer oral medication. The last one, which is the E, is that now the patient has been stable, or the patient has been relieved of their pain or any complaints. And now the patient is due to either be transferred out to a different unit, or patient is due to be discharged home. That now leads us into evaluation. So evaluation simply is maybe handing over the patient's care to maybe a colleague which is going to take up from you, or to another nurse at a different unit, or to a doctor at a different unit. So that is an overview of the API stations. That is an overview of the API stations. Please, if you are following, can you type yes in the comment section? And is anyone having any questions at this point? If you are following, type yes. If you have fully understood the API stations, type yes. If you haven't, you type no. But if you have understood the API stations, type yes. Great. So now, let's look at Uncover. Have you got any specific questions with regards to just the overview of the API? We said assessment, which is the A, is when we need to do assessment on our patients before we admit our patients. P is where we identify some complaints or problems of our patients, and then we write a nursing care plan. And then the I is where we need to administer oral medication. And then the E is where we need to hand over the patient's care to someone who is going to take up from us, or or to another nurse that we need to maybe transfer out our patient to. So that is the API stations. Great. So now this is what we're going to do. We are going to look at the API conditions. So just as you know, just as I was saying that now the patient is going to see the doctor, the doctor needs to diagnose the patient. Let's look at the conditions that we are going to be assessed on. Let's look at the conditions we are going to be assessed on for the API stations. So I will be sharing some of these documents on the YouTube now. Let's first look at that of the midwives. Right. So the midwifery, these are the 3 conditions that you are going to be assessed on for the API stations. So this means that you are going to be assessed on one of these conditions. And so when on the OSCE day, you are being given that you are doing antenatal admission, it means that you are doing assessment on the antenatal admission, and you are doing planning on the antenatal admission, and you are doing implementation, likewise evaluation. I hope it makes sense. So it's either you're going to be doing antenatal admission, labor and birth, or postnatal visit. So those are the 3 sets of conditions that you will be given one of them, and then you need to complete the assessment, planning, implementation, and then the evaluation. If we have understood that part, can I get a yes in the comment section? If we have understood that part, can I get a yes in the comment section? So you don't know which of these that you're going to get. Unless you get there, you'll be given one of these. Can I get a yes in the comment section so that we can move on? Right. So for those on TikTok, I just mentioned the 3 conditions: antenatal admission, labor and birth, and then postnatal visits. You are going to be given one of these conditions, and you need to do assessment, planning, implementation, and evaluation on that condition. Now let's look at that of nursing associates. Let's look at that of nursing associates. So this is for nursing associates. This is for nursing associates. You remember I said that for nursing associates, you are lucky that you will know exactly what you're going to be assessed on. And so looking at the condition that you're going to get for the API station, you are only having the hospital admission. You are only having hospital admission. So this means you just need to prepare for hospital admission. And so for the hospital admission, if you remember when I was going through the 1 to 10, I mentioned that for nursing associates, there's going to be a slight change. So this is a slight change. You say that they will only do assessment, planning, and then evaluation. Assessment, implementation, and then evaluation. Assessment, implementation, and then evaluation. So those are the 3 stations that the nursing associates will be completing under the API stations. Under the API station. So nursing associates will not be doing planning. That is what you need to understand. They will not be doing planning. Right. Now let's move away from nursing associates and then look at adult nursing. So as you can see, for adult nursing, you have up to 10 conditions, and you'll be given one out of these 10 conditions for you to complete the API stations. So you are either going to be given Alzheimer's disease, chronic heart failure, community assessment, ectopic pregnancy, end of life, suspected deep vein thrombosis, hernia, homelessness, pneumonia, or subdural hematoma. So these are the 10 conditions that your patient is going to likely be diagnosed of one. And so you are going to do assessment for the condition you'll be given. You're going to do planning for the condition you'll be given. You're going to do implementation for the condition you'll be given. And then you're going to do evaluation for the condition that you will be given. For those going to join the UK NMC as adult nurses, I hope you understand this. Can you give me a yes in the comment section? Can you give me a yes in the comment section? Good. Right. And then last but not the least is for mental health nursing. So mental health nursing follows right under the adult nursing. You also do have, I think, 3 conditions. There is depression and suicide ideation. There is bipolar disorder, and then there is one which is anxiety. That is the 3rd condition that has been added. So you are going to be assessed on one of those conditions, but you need to do assessment, planning, implementation, and then evaluation. Right. So those are the conditions we should expect for the API stations. And so are there any questions up to this point? Now, if you look at the conditions, are there any questions up to this point? Any questions on YouTube or any questions on TikTok? Okay. Now, since we've gotten an idea of what the conditions we should be expecting for the API stations, let's look at some documents that we need to use to prepare ourselves, or we need to use to preparing or to guide our preparation for the OSCE exam. Don't forget, we've not done the 5, 6, 7, 8, and we've not discussed professional values. We've not discussed evidence-based practice. We will come back and take it one after the other. But let's look at these documents that we will need to prepare for our OSCE. So documents that we're going to need. The first document I would like you to write is the OSCE timing stations, the one we just looked at. That's the first thing we need, the OSCE timing stations, so that we will know all the conditions and we will know all the stations. OSCE timing stations. So if you're wondering, so that is the OSCE timing stations. That is the OSCE timing stations. The next document that we need to prepare for the OSCE exam is the marking criteria. Is the marking criteria. So if you are writing, write it down, marking criteria. So let me show you how the marking criteria looks like. 1 minute. So the marking criteria is what the assessor will be looking at to be able to mark you or to assess you throughout the station. That is the marking criteria. So this is how the marking criteria looks like. This is how the marking criteria looks like. So it is going to have all the conditions and all the stations. So for the assessment, the assessor is going to be looking at all these numbered specific steps that you need to carry out when you are doing the assessment, and will be marking you against this list. And so the next document, or the most important, the important document that you need is the marking criteria after the OSCE timing stations. We will come back to look at the assessment overview. So just write it down that you need the marking criteria. Now, the other document that you need is the updated supporting document. It's the updated supporting document. And I'm going to show you what is in the updated supporting document. So every specialty, whether you are joining as adult nurse, nursing associate, midwife, or mental health nurse, you are going to have specific documents. So when you are downloading, you need to be very specific with the documents that you are going to download. So next document I'll be showing you is the supporting document. So that is how the supporting document looks like. So that's the front page, test of competence supporting document. So if you want to find any information about a specific station, so the TED stockings or anti-embolism stockings is one of the newest introduced stations. And so if you are hoping to at least get an idea how you are going to prepare for this particular station, then you need to get your hands on the updated supporting document. So everything you need to prepare for any specific station is in the supporting documents. So this is a prescription that you will need in one of the stations. Right. The other documents that you will need is the equipment list or equipment documents. For those that may be not familiar with some of the new equipment that is currently not used in your home country, you may want to at least know some of the equipment so that on the OSCE day, you wouldn't be surprised. So let me see if I can show you the just give me 1 minute. Right, so that is also the equipment list for you to know what equipment you are going to be using during the OSCE exam. So these are the lists of all the equipment you will be using. So when you look at this one, the bed with blankets, pillows, and sheets, this is what the, you can see the images you are showing. Right, so the images are being showed on YouTube live at the moment. So you may want to join me on YouTube to be able to see the documents. So this is how the OSCE is going to look like. The OSCE exam room, this is how it's going to look like. So this is how it's going to look like. So your mannequin or your patient will be in bed, and then depending on a particular station, the mannequin or the patient will be in bed, and then this is how the bed is with the medication or the drug box on that side, and then with every other thing beside the patient, and you just have to stand beside your patient and then perform your station. Right. So apart from the equipment list, there is another important document that you will need. And that important document at the moment is not available to everyone, unfortunately. It is only available to candidates who are able to join our training. So that is the document I'm talking about, the Ultimate NMC OSCE Guide. This document has been prepared by the assessors on the team, and it is, so sometimes we call it the second brain because it contains everything that any candidate preparing for UK NMC OSCE needs to have. Everything that you have to know is being listed in here, with exact word to word what you need to present, how to present it. We've written everything for you. So even if you get hold of this book, you can prepare by yourself with little guidance from any assessor or someone who has already gone to pass their OSCE exam. So this is unfortunately is only available to those who are currently part of the training or part of the cohorts that we are preparing for the OSCE. And so hopefully, once you are ready to be able to get guidance from us, then you will be able to get hold of this particular document. So at least I have been able to share with you all the necessary documents that you need to be able to prepare for your OSCE exam. Are there any questions? Did we all get all the documents listed? Did we all get all the documents listed? So you need the OSCE timing stations, you need a supporting documents, you need a marking criteria, and then you need the equipment list as well, and then you need the ultimate NMC OSCE guide, which is prepared by ourselves based on years of experience of guiding candidates for them to go and pass in a first attempt. That is what we have kept in order book so that you will be able to use it as guidance. And so this is to remind anyone who is currently watching or who will be watching this later that next class is going to begin on Monday, which is Monday, 3rd of August. So if you're going to watch this maybe later after 3rd of August, you can still reach out to myself and we will hopefully guide you for you to prepare for your OSCE exam. If you're unable to join this cohort, then any other cohorts that your time will be ready, you can join that cohort. Just reach out to me and we are happy to guide you for you to go and pass on your first attempt. Now, since we have gone through the documents that we need to prepare for the OSCE, let's now look at the assessment, what the expectation is. Let's look at the planning, what the expectation is. Let's look at implementation, what the expectation is. And then look at the evaluation, what the expectation is. Now I'm going to share with you a document. That document is the scenario, one of the scenarios for the adult lesson. We are still on API. We've not moved. We are still on API. We've looked at the overview of API, but now we are going to look at the expectation. And then we will compare to what the marking criteria expects from us to deliver on each of these stations. So we are using one of the conditions from the adult nursing stations. And that is pneumonia. So I hope you can see. And please, can you see this clearly? If you can, do well to type yes in the comment section if you can see this clearly. So for those on TikTok, unfortunately, you may have to join me on YouTube to be able to have a look at the document that is being shared. Right. So on the OSCE day, the assessor is going to give you a brief, or they are going to read a brief of what I'm about to read to you. And so when it is time for you to do your assessment, this is what the assessor is going to tell you. That you are either a registered nurse or registered adult nurse or registered nursing associate or a registered midwife working on a particular unit. Please conduct a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual care needs. So once you see those highlighted parts, it means that the assessor is expecting to hear these things when you are doing your assessment. So repeating, please conduct a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual care needs. As part of your assessment, please complete an A to E assessment. So those making notes, you are being expected to do A to E assessment. So you can write A to E assessment somewhere. Now we are discussing assessment, so you can write A to E assessment somewhere. And for the A to E assessment, this is the expectation: airway, breathing, circulation, disability, and exposure. So you are expected to conduct assessment on the airway of your patient, breathing of your patient, circulation, disability, and then exposure. And take and record the patient's vital signs. So whilst you are doing airway, breathing, circulation, disability, exposure, you are expected to take and record the patient's vital signs. That is the blood pressure, the temperature, pulse rate, oxygen saturations, and then respiratory rate. And calculate the National Early Warning Score, or the NEWS score. So if you are writing in your notes, 1, the assessor is expecting you to do A to E assessment and expecting you to record the patient's vital signs. 2, assessor is also expecting you to calculate the National Early Warning Score, that's the NEWS score. Again, the assessor is expecting you to also do physical, psychosocial, spiritual, and sexual care needs. Do an assessment on that as well, which we call the holistic assessment. So these are the expectations. Did we all get what is expected of us? Did we all get what is expected of us? If you heard that clearly, in your notes, whatever you've written, type it in the comment section. Let's see if you are following. What are you expected to cover when you are doing the A to E, or when you are doing your assessments, based on what I've just read to you? What are you expected to cover? Mhm. For those following, if you can type it in the comment section. In the assessment, what one thing is the assessor expecting from you? Mhm. What one thing is the assessor expecting from you when you're doing assessment? Mhm. Right. So A, B, C, D, E, vitals, good. And then A to E assessment, vital signs, good. Monitor vital signs, very good. Yes. Who else? Who else? So yes, rightly stated in the comment section, the assessor is expecting you to complete an A to E assessment, which we've just mentioned. The A is for airway, B is for breathing, C is for circulation, D is for disability, and then E is for exposure. And then you're expected to take the vital signs, which is the blood pressure, temperature, pulse rate, oxygen saturation, and then respiratory rate. And also, you are expected to calculate a NEWS 2 score and also complete a holistic assessment, which includes the physical, psychosocial, spiritual, and then sexual care needs. So that is the expectation. So if you have not stated anything at all, now you know that this is what the assessor is expecting you to do. And for this, it stated that depending on the patient's circumstance or condition, you may wish to focus on some areas of assessment in more depth than others. Yes, for that, we may not be able to go more in depth into it, but this is the overview. And then please note that there is no need to remove the patient's clothing to assess the exposure. Please ask the examiner for any additional clinical information you require. And all equipment has been checked, calibrated, and is clean. An observation chart is provided and must be completed within the station. So every station that you get, the observation chart that you are going to chart the patient's vital signs will be added to this scenario. The document must be completed using a green pen. You have 20 minutes to complete this station, including the completion of the following documentation, the NEWS chart. And then assume it's today and the time is 10:00. Assume it's today and the time is 10:00. So on your OSCE day, when this has been given to you, this brief has been given to you, you will now get this additional brief. That is the patient's overview of the recent history. So these are your patient's details. Our patient is Mike Bell. The date of birth is 10/07/1925. That's the hospital number, that's the address, and that's the GP. So that is the patient presenting complaints. That's the past medical history. That's the social history, the drug history, and then the allergies. So this is also going to be given or to be added to the first scenario that we just read. So this is what you're going to base on to do your assessment station. You are always going to be given this. So the next one is the planning, which so this part is also going to be added to the assessment or the assessment scenario. You'll be given these empty spaces. The advice here is that even if you forget that you are doing A to E, they have stated airway, breathing, circulation, disability, exposure, and they've also stated here physical, psychosocial, spiritual, sexual care needs here. So just follow what they've written in the extra documents that they add to the scenario, and then you just follow each step by step, and then you are able to complete your A to E assessment. Right. So A, B, C, D, check vitals and record, and also the NEWS score. Brilliant. So that is an overview of assessments that you are being expected to complete by the assessor. I hope there are no questions up to this point. So I am going to stop sharing, and I'm going to look at, or we are going to look at the marking criteria to see how the assessor will be assessing us. when we have been given this particular scenario and we are expected to complete the assessment. So just give me 1 minute. Let's see how the assessor is going to assess us when we need to complete. Right. So assessment. Now this is the list that the assessor will be going through when you are doing your assessment station. First, the assessor expects you to assess the safety of the scene and then the privacy and dignity of the patient. So in doing this, you are going to tell the assessor that you can see or you've assessed the situation or you've assessed the scene and the scene is safe to approach, and then you are going to provide privacy and dignity for your patient. Once you are able to say this to the assessor will take the first one that you've done it. Now, the next thing you need to do is stated here that you need to also do your hand hygiene. So clean the hands with alcohol hand rub or washes with soap and water and dries with paper towels following the WHO guidelines. So once you're able to demonstrate that you can do hand hygiene, the assessor will then mark you. So when we are training our candidates, we take them through some very basic steps such that they will cover this within very few seconds. They will cover this within very few seconds. So cleaning your hands, you need to now learn how to do hand hygiene. So washing your hands according to the WHO guidelines, pouring an ample of gel into your palm, rubbing palm to palm, palm over dorsum, fingers interlace, fingers interlock, rotational rubbing of the thumbs, rotational rubbing of the tip of the fingers, rotational rubbing of the wrist, and then allowing your hands to dry for 30 seconds. You need to demonstrate it whilst you are verbalizing this to the assessor. So once you've done that, the assessor will now mark you, and then the assessor will be observing you for the next point. So the assessor will be waiting to see if you're going to introduce yourself. So by introducing yourself, you can say that, "Hi, I'm Nurse Ima, and I'm one of your attending nurses for today." Once the assessor hears that you've said this, then the assessor will mark you. Move on to the next one. Please, I hope we are following. Can I get yeses in the comments if we are following? Can I get some yeses in the comments if we are following? Good. So that is why we always say that OSCE is not difficult as it has been projected. You just have to know how to approach every station. And that is what we are giving you. We are ready to prepare you, fully ready for you to go and pass on your first attempt. Now, the next point is checks identity with the person. The person's name is essential, and either their date of birth or hospital number. So you can ask. So verbally, you are expected to ask the patient verbally and then check against the wristband and documentation. So once you've introduced yourself, "Hi, I'm Nesima. I'm one of your attending nurses for today. Can you please confirm your full name, your date of birth?" So if you can see in the brackets, it says the person's name and either their date of birth or their hospital number. So can you please confirm your full name and your date of birth for me as I cross-check with your wristband and my documents? Once you've said this, then assessor will know that, wow, this candidate knows exactly what they are doing. So then the assessor will take you. So now, just as I am walking through with you, you can see that the assessor has marked first one, second one, third one, fourth one. And so the assessor is waiting on you for you to do the next one, which is checks for allergies verbally and then or on the wristband. Now, one thing that you need to know, which is a tip that we are sharing on this live session, is that your patient is going to have a white wristband, which has got their name, their date of birth, that is just their biodata. If your patient has got a red wristband, it means that your patient is having allergies. So this is a take-home tip. Know that once your patient has got a red wristband, it means that they have allergies. So you need to confirm the allergies. So do you have any allergies? If yes, what is your reaction? Once you ask this question and patient says, oh, I do not have any allergies, or I have allergy, or I'm allergic to, let's say, paracetamol, and I get maybe rashes, the assessor will now mark the 0.5 for you. Now, next one is the 6th point, which is gain consent and explains the reason for assessment. Gain consent and explain the reason for assessment. So you now have to tell the patient why you are there. Hi, Mr. Mike, I'm here to do an A to E assessment. Is it the right time? And are you happy for us to continue or for me to carry on with this procedure? That is you gaining consent. If patient says yes, assessor will now mark you. Okay, so this candidate has now asked for consent. And then the next one says uses a calm voice, speech is clear, body language is open, personal space is appropriate. So these are the observations that the assessor is going to observe that you will do. Have a very calm voice, do not shout or talk over your patient, and then your speech is also clear. Do not just be as quick to confuse your patient. Body language, how have you positioned yourself? Right, so a question, do you stop at this point to treat allergies or just move on and continue? So unfortunately, you are not going to treat allergies because you've not given your patient anything. However, you will inform your patient that once you've confirmed with the allergies, you are aware and you are not going to give them anything of that allergic reaction that they will have, or anything that will get them to maybe show any signs of allergies. Just for you to note that you've identified the patient has got allergies and you are aware of what the material or whatever drug or what is going to cause the allergic reaction is. Okay. Now, next one is, and then the personal space. So body language is open. Do not put your hands in your pockets and do not fold your hands as if you are acting as a boss or anything. Just have an open body language. Smile. Personal space. Make sure that you are not encroaching on the patient's personal space. These are all observations that the assessor is looking at you. And so the next one is conduct an A to E assessment. So during our training, we walk our candidates through the airway, breathing, circulation, disability, exposure. So you can finish this within very short time so that it does not eat up into your time. So airway, you are expecting your patient to cough so that at least, or your patient to recognize that there are no visual obstructions as you are speaking to your patient and your patient is engaging you with a conversation. Once you do that, assessor will now mark you, oh, this patient or this candidate has done the airway. So Mike, as I'm speaking to you, I can see that you are speaking in full sentences. And so I can verbalize, or I can say that there is no visual obstruction. Or can you cough for me to see? And then once the patient coughs, you can say that, okay, well, I can confirm that there are no visual obstructions. Assessor will now mark, okay, this candidate is aware. He's finished with the airway. Now, next one, candidate needs to complete breathing and circulation. You need to complete breathing and circulation. So, breathing and circulation, there are a few things that you need to cover. So, when you check, there is respiratory rate and the rhythm and then the depth. There is also the oxygen saturation level as well. There's also respiratory noises. There is unequal air entry, visual signs of respiratory distress, and then use of accessory or respiratory muscles, sweating, cyanosis, seesaw breathing. The assessor is expecting you to mention all of these, not word to word, but at least make sure that you check the patient's respiratory rate, and then you mention the depth of and then the depth and then the rhythm of how your patient is breathing. So mostly we discuss with our candidates for them to do the breathing and circulation together, making sure to check the capillary refill. After checking capillary refill, making sure to check the respiration and the oxygen saturation next. So you'll be using the pulse oximeter to check the oxygen saturation. When you are done, you move on to the next one, check the respiration and then the pulse. So when you are checking the pulse, you make sure that the pulse and the respiration, you are using full 2 minutes. 1 whole minute for the pulse, another 1 whole minute for the respiration. If you fail to get to that 1 minute, the assessor is not going to pass you, unfortunately. So Mike, I'm going to check your capillary refill. Can I press your finger on your nail bed for 5 seconds, allow you to dry for, allow you to refill for 2 seconds? Okay. Assessor, I've done that, and I can confirm that there's no signs of pallor. Capillary refill is good, and then patient is also warm to touch. Next one. All right, so I'm going to locate your radial artery, and then you do that. You locate it, and then you check. So assessor, I'm using full 2 minutes. My time starts now. And then the assessor will be checking with you, right? You said you're using full 2 minutes, 1 minute. You've done with the respiration. Okay, respiratory rate, I had this, and this is the normal rhythm with. So normal rhythm and depth, and then you move on. Okay, now you are doing the next one, which is the pulse. I'm sorry, the respiration. So these are some tips I'm sharing with you. Once you finish checking your pulse, you observe the patient's chest so that the assessor will be aware that you are now checking the respiration and you are using 1 whole minute. When you finish, you tell the patient, oh, I've checked your respiration and this is it. Sorry, I didn't tell you because it could have altered the results. This is it, and it is with normal rhythm and then maybe strength. The normal rhythm and depth, that's the respiration. The pulse is the normal rhythm and then the strength. Making sure you tell your patient that they were not using any accessory muscles, or if they were using accessory muscles, and if there were no respiratory noises, you need to also mention that. So you cover all these things, and then the assessor will be interested that you are mentioning all these things for the breathing, and then for the circulation, you are mentioning all these things. When you are done, you now move to the disability. So if you paid attention, you realize that we've checked our patient's pulse, we've checked our patient's respiration, we've checked our patient's oxygen saturation. So we are now going to be transferring them onto the observation chart. When we were reading the scenario, it was stated that we need to check the patient's vital signs. Right. So how will you inform the assessor that you finished the pulse and respiration? Right. So because when you were about to mention or when you're about to check the pulse and respiration, you inform the assessor that you're using full 2 minutes, and you told the assessor, my time starts now. The assessor is going to observe the time with you. So the assessor will know that after 1 minute, you are finished checking your pulse. After another 1 minute, you finish checking your respiration, and then you can now tell the patient the results of the pulse and respiration. That is how the assessor will know. Okay, now the next one is disability. So disability, you're asking questions if the patient is okay, they know where they are, that is the consciousness level. So is the patient alert? Is the patient confused? Is the patient got unresponsive to pain? And then has the patient passed urine? Has the patient's blood glucose been checked? Is the patient in pain? These are questions the assessor is expecting you to ask. So Mike, are you in any pain at this moment? Do you know where you are? Okay, have you passed urine? Has your blood glucose been checked? These are quick questions the assessor is expecting you to ask. Now the next one is the exposure. So for exposure, you are going to take the temperature. So you take and record the temperature by using the infrared thermometer. You're not going to be using the what do we call it? The analog one that you put in the patient armpit. No, it's just the infrared one, the gun thermometer. Yeah. So once you've done that, you are now going to ask if there are any presence of bleeding, any rashes, any bruises anywhere. And that is exposure. So now that is A to E assessment. That is the A to E assessment. And the assessor is going to observe for you to do the A to E, making sure that you've taken all your vitals and it is ready to be transferred into the observation chart. So you realize that the next one, which is the point 9, says that accurately measures and documents the patient's vital signs and any specific assessment tools. The any specific assessment tools will be discussed later. Maybe not on this live session, maybe another session. So calculate and record the relevant scores accurately. So the news tool, if there is another documentation, which for those who have gone through our training will know, and for those who are currently preparing will also know, 6, 8, and then a must, you need to calculate all of that. Accurately complete the documents, the signs, adds date, time, and then the assessment chart on the assessment chart. So make sure that if you are charting, you chart accurately. And then you conduct a holistic assessment relevant to the patient scenario. So holistic assessment is where you now have to go back to the scenario. If you remember the scenario that we read with the patient overview, you need to now go back to it and ask your patient the information on there, the past medical history, the present medical history, the drug history, the social history. You are asking your patient if all those information on there, they are the right information. So that is the holistic assessment. And then once you finish, the next thing to do is to ask if patient has got any physical, psychosocial, spiritual, and then mental, sexual needs that the patient would like for you to attend to. And that is your A to E assessment. And that is your A to E assessment. So this is what we are expected to cover. And now 13 says disposes equipment, clean your hands, and then act professionally. So once you finish with that, you tell your patient, okay, this is the vital signs I did, this is the news to score I had, and this is what it means to you. And therefore, I'm done. Do you have any questions? Do you have any questions? Do you have any concerns? If there are none, then this is the end of the procedure. So you tell the assessor, you do a quick hand hygiene, and then that's it. But the advice here is that you are not expected to follow the 1 to 15 points, like in that order. If you forget a particular point or a particular step, you are always able to go back and then do it. The assessor is still going to mark you. So this is the A to E assessment, and then the holistic assessment, vitals, observations. So this is an overview. I hope we are following. If you are following, kindly type yes in the comment section. If you are following, kindly type yes in the comment section. Right. Are there any questions at this point for the assessment? Are there any questions? Are there any questions for the assessment? So if there are no questions, we are going to look at an example of planning. We're going to look at an example of planning, or better still, let me show you how you are going to chart your observations on the news tool charts, and then we'll look at planning, and then a quick look at the implementation and the evaluation. So quick question, is it possible to get an unconscious patient? If yes, who do you take consent from? So you are not going to get an unconscious patient. All your patients are going to be conscious. For the sake of the OSCE, all your patients are going to be conscious. Do you record the respiration and pause and continue, or you finish everything? So you are going to take the observations, and then when you finish with the E, remember we did A to E. When you finish with the E, you now let your patient, you inform your patient to give you some time so that you can then go and transfer all your observations on this news tool, which we are about to have a look at. And then once you finish, you can now come back to your patient. So we're looking at the news tool charts, which all of these are in the workbook. So this is how a completed news tool looks like. So you will have the patient details at the top there, and then you'd see that there is a date and time. You need to write the date in the first box, the time also as well, and the respiration. So whatever respiration that you had, you indicate it. And then the SpO2, whatever SpO2, oxygen saturation that you had, you'll also indicate it, you write it there. And then the air or oxygen, you look at your patient, is your patient is on oxygen or is your patient breathing normally? Then you write A there, because all your patients are going to be normal persons. And then the blood pressure, you now write the systolic, and then you write the diastolic there, and then you just join them using these top and down arrows with the short dashes there. And then the pulse, you write the patient's pulse that you had also. And then the consciousness, because your patient is conscious during the time that you were taking the vitals, you just write the A there. And then the temperature, you write the patient's temperature there as well. And then the news total. Now, for those who may be wondering what is news total, let's quickly go up here. I'm just giving a quick overview. News key, we have 0, 1, 2, 3. And these news key have been written in the middle of our observation charts. So what it simply means is that whenever you write your value, ask yourself, does it correspond to any of the news key? If it corresponds to any of the news keys, then you have to just write that news key down, and then you add all of the news keys that corresponded to any of your values that you've written. When you are done, you add all of them together, and that is the total news here. So this one, our total news is 0, and then that will inform our monitoring frequency, which will also be given to you on the OSCE day, this one. So depending on the news key that you get, that will inform us the monitoring frequency. So that's it. And then the escalation of care, it's also next to it. So you look at it and then you write what you would do, and then you either escalate the care or you would not escalate the care. And then the initials, you write your initials there. So that is a complete observations chart. So for the one who was asking, or for those who were wondering, the observations that you take from your patient, the vital signs, this is where you transfer them onto your observation chart. Now, there are certain conditions that you would not be using this news chart. You would be using the GCS chart. And then for midwives, you'll also be using another chart. So basically, that is that for the assessment. Now let's quickly look at the planning. We are looking at an example of planning. Right. So this is planning, but before that, let's see if we can look at what the scenario would be let's look at what the scenario would be before we look at so when it's time for you to do your planning, this is what the scenario would say. It is not going to be word for word, but then the scenario would sound like this. Mike Bell has been admitted with shortness of breath and has a diagnosis of chest infection or pneumonia. Now, based on your nursing assessment, please produce a nursing care plan for 2 relevant aspects of the nursing care suitable for the next 24 hours. This is a silent written station. Please ensure that you write legibly and clearly. You have 14 minutes to complete this station, including all the required documentation. So you've been told that for this station, it is silent station. So it means that the assessor will not be looking or will not be observing you whilst you complete the station. The assessor will leave you for you to just complete it. And when the time is up, the assessor will now come back to you and then take what you've written. You have 14 minutes to write 2 relevant aspects of nursing care suitable for the next 24 hours. So now let's look at an example of the planning that is being completed. So don't forget this part, you need to identify 2 complaints or 2 problems. You can either identify it from the scenario or you can identify it during the time that you were doing the assessment on your patient. So can I get people to just type in the comment section some of the complaints that we think our patient is having based on what I've just read? Can we identify a complaint or a problem with our patient? Difficulty in breathing. Thank you. Who else? Who else? Okay, shortness of breath. So you should give nebulizer. Okay. Right. So now let's go to the overview of the patient's information. Papa, you're welcome. So let's go through the presenting complaints. Coughing as well. All right. So let's go to the presenting complaints. Can we identify any? Can we identify any chest pain? All right. Can we identify any complaints or any problem? Papa, welcome. Right. Can we identify any complaints from the presenting complaints that we are seeing? Admitted with shortness of breath. coughing with thick green sputum, diagnosis of chest infection, pneumonia, right? Shortness of breath, shortness of breath, coughing, good. So now it means that it is easier for us to be able to identify patients' complaints. Now, after identifying these complaints, let's see how to complete a nursing care plan. Let me just share one example. Let me just share one example with you. Right, so this is how a completed care plan will look like. This is how a completed care plan will look like. So first of all, you'd see that there is nursing problem or the need. So just as we all stated, there is shortness of breath, there is coughing, and then there is what? Yeah, shortness of breath. Okay. So the nursing problem we've all identified is that our patient is having shortness of breath. So Mike is experiencing shortness of breath, or Mike is experiencing breathlessness related to chest infection or disease condition. You can just leave it at Mike is experiencing shortness of breath and you are good to go. So if you are completing a nursing care plan for the OSCE, first of all, there is a nursing problem that you need to identify. The next one is the aims of care. Aims of care simply means that what do you seek to achieve? What do you seek to achieve within that 24-hour period? What do you seek to achieve? So the aims of care for this identified problem is that Mike will have a normal breathing pattern within the shift. Mike will have a normal breathing pattern within the shift, as evidenced by respiratory rate of 12 to 20 beats per minute. Sorry, breath per minute, because we are dealing with respiration. So that is aims of care. And then reevaluation time. When do you want to reevaluate this care plan to see if patient is at least improving or not? So reevaluation time frame is today. That is the day of the exam. And then the number of times or how often you're going to reevaluate is every hourly. Every hourly. Because we are dealing with respiration, we cannot just leave our patients to just be there and then maybe at the end of the shift, that's when we're going to assess our patients' breathing. No. And then if, whilst we are still waiting for our patient to get better, if any clinical condition changes, or if the clinical condition changes, then we will quickly have to go and then attend to our patients. So that's a reevaluation time frame. And there is an approach on how we prepare our candidates for them to be able to have all this at the back of their heads, for them not to stress so hard when they are writing this. Now, for the nursing interventions, there is a formula on how to go about this. And so the only thing you need to know is the formula in your head. Once you get there, it is easier for you to write at least 8 to 9 of the nursing interventions, because most of them stays the same, a few changes here and there. So these are the nursing interventions that the nurse is going to go through, or you are going to go through, to be able to relieve your patient of the breathlessness. The first one is explain all aspects of care to Mike and then gain consent, monitor Mike's observation and escalate as per News 2 policy, assist Mike for signs of respiratory distress, such as cyanosis, teach Mike deep breathing exercise and relaxation techniques, assist or encourage Mike to assume a most comfortable position, administer Mike's prescribed medication, and monitor for its effectiveness after 30 minutes. And then refer Mike to the respiratory team for further care plan, educate Mike on the proper use of call-bell, and then document all care rendered. This is how a typical planning will sound like or will look like. But you need to complete 2 of these, one for each complaint that you identify. I hope we are following. If you are following, kindly type yes in the comment section. That is planning. If you are following, type yes in the comment section. Good. If you are following, kindly type yes in the comment section. If you are following, those on YouTube, if you are following, kindly type yes in the comment section. All right, good. So now we've had an overview of assessments, and now we've had an overview of planning. The next thing that we need to look at is the implementation. The next thing that we need to look at is the implementation. So now let's go back to the scenario that we are using to find out how the scenario will be given to us for us to complete the implementation. And then once we look at implementation, we can now look at evaluation, and then we will be done with the API stations. So just 1 minute, let's look at the scenario. Going back to our pneumonia scenario. Right. So this is an empty space or empty sheet for the planning. So if you are preparing, you may need to maybe print out some of these so that you can use to practice. And don't forget that once you finish with your care plan and you fail to write your name, your signature, or the dates, you are going to fail the station. So be careful. Make sure you have your name, nurse's signature, and then your dates all on there. Now for planning, for implementation, this is how the scenario will be given to you. So my bell is being treated for pneumonia. Talk to the person. Please verbalize what you are doing and why to the examiner. Read out the chart. So this is a prescription chart. So that is that chart, not the observation chart. Read out the chart and explain what you are checking, giving or not giving, and why. So this is what the assessor is expecting from you. Read out the chart, explain what you are checking, giving, not giving, and why. Complete all the required drug administration checks. Complete the documentation and use the correct codes. And then the correct codes for non-administration are on the charts. So you don't need to memorize anything. So if you need to administer, or if you don't need to administer anything, it's on the chart. So you don't need to memorize them. And then check and complete the last page of the chart. You have only 15 minutes to complete the implementation station, including all the required documentation. And assume it's today, and then the time is 1400. Now, implementation, you would need to approach your patient first and then inform your patient that you've come to administer oral medications to your patient. And when you finish, you need to now let your patient give you consent for you to carry on with the implementation of the station, which is the administration of the oral medications. And now you need to validate. So that is what it means. You need to validate the prescription. Validation simply means that go through this prescription, make sure that everything is correct, and you have identified the medication that your patient can take and you can administer to your patient, so that when you finish with the validation, you can go and gather the medication. When you return, you can now administer the medication to your patient. Does it make sense? If it makes sense, please either give me a thumbs up or type a yes in the comment section. That is simply implementation. Come and administer oral medication, or go and administer oral medication to your patients. All right, so I'm taking it again. This whole sheet is prescription chart. Prescription simply means that the medications you need to administer to your patients has been stated, or it has been given, or it has been written in this prescription chart. And you need to go through all these documents and make sure that the time that you need to administer the medications to your patients, you have been able to identify the specific medication you can administer and the ones that you cannot administer. And once you have been able to finish with that, you can now go and then get your medications and then bring it to your patient so that you can administer to your patients. I hope now it makes sense. I hope now it makes sense. Can I get a yes in the comment section if it makes sense? Right. Any other yeses in the comment section? Any other yeses in the comment section? I hope we understand the implementation and what we are going to do. I hope we understand the implementation of what we are going to do. Can I get a yes? Okay. Now, what time are we supposed to administer the medication that we want to administer? What time? Is anyone able to type it in the comment section? What time are we supposed to administer the medication? Anyone? Can anyone have a wild guess? What time do we think we are going to administer the medication? Oh, anyone in the comment section? What time are we supposed to? 1400? Okay. Who else? Who else? So if complete all sections of the document, assume it's today and it is 1600 hours. Right. So the time is 1600 hours. That is the time that we need to administer the medication. What this means is that every medication that is due at 1600 is what we are going to administer. I hope it makes sense. It's all right. So every medication that is due at 1600 is what we're going to administer. That is what it simply means. So for those who have joined us on TikTok, if you are not aware, we're currently on YouTube and I'm sharing some documents. So if you would like to maybe join us, that would be easier for you to see what I'm sharing. So now we are quickly going to walk through the implementation to see if there is any medication that is due at 1600. Don't forget that whilst you are checking the time, you are also paying attention if the patient has any allergies. Okay. So I'm just going to quickly walk through this. So this is how we prepare candidates for them to be able to work through this implementation sheet. Very quickly identify the medications that the patient is due to be able to know which of the medications they are going to administer. But you need to validate this prescription by reading everything on the chart. So hospital medication prescription administration record. Surname Mike, Bell, forename Mike. So you just read everything here. Mike Bell, 10/07/1905, hospital number 123905885, acute medical ward. Then dates today, height 1.70, weight 85, BMI is not given, consultant Dr. Lord, time of admission is 900. The number of prescription, one or chart, 1 out of 1. You need to go through all of this. All prescribers must complete a signature record. You mention what is there. Details of the person administering medication, that is you, the nurse. So you will tell the assessor, you will come back here to complete this chart when you are done administering your medication. Now for allergies, it says that alerts, a patient is allergic to penicillin and peanuts and reacts by having anaphylaxis. And then you need to verbalize the signature there and then the bleep number of the doctor who has confirmed it. Medication risk factors, there is nothing ticked. So we move on to the next page. So this is the one that they stated in the bullet point that the medicine administration, self-administration, these are the codes of administration of medications. The codes 1 to 10. These are the codes you're going to use. If patient is unable to take a particular medication, although they are due to take that medication. So 5 says that start dose is given. 6 says that prescription is incorrect. 10 says that other states in nursing notes, including action taken. So this is what we mostly use for allergies. So if patient is unable to take any of the medication, although they are due to take it, you are going to indicate or use one of these codes. Right. So I'm just going to show you, and then you tell me if patient is due for the medication or not. So looking at this chart, looking at this prescription chart, if you feel that your patient is due to take the drug amoxicillin, type yes in the comment section. If you feel your patient is not ready, or if the patient will not be able to take the medication or is not due to take the medication, type no. Unfortunately, those on TikTok will not be able to see it. So the time that the amoxicillin has been prescribed for us to give, this is a clue for those on TikTok. The time is 800. The first time is 800. The next one is 1600. The finish date is 2200. So are we going to administer the medication or not? This is the reason why I asked what time we are expected to administer our medications, and people stated 1600. So looking at this prescription, are we allowed to give this medication or not? Okay, so I've seen yes, yes, yes. Yes, that's correct. So it means that if we have a medication and it is due 1600, we can administer. Right, let's move on to the next one. So drug clarithromycin, can we administer this medication or not? So the drug clarithromycin, the date is the time. We have 800, we have 1600, and we have 2200. So can we administer the medication or not? Can we administer the medication or not? Right. Yes. Okay, good. So it means that we are following. Now, what about this drug ramipril? It has got 1600 on the prescription. Can we administer it or not? Drug ramipril, it has got 1600. Can we administer it or not? Yes, Mike is due. All right, good. So we can administer, right? Now let's move on to the next one, drug oxybutynin. We also have 1600. Can we administer it or not? Right, so we can administer as well. Good. Okay, so this one has already been given. Right. And then we have as required medicines. So just a quick overview for as required medicines. Just as the name goes, as required means that when it is required or when it is necessary, that's when we can administer this medication. When it is necessary. So that's why there is no time. So you will be the one to determine whether you can administer the medication whilst you are administering the previous medications that we've looked at or not. So that is how you go about as required. So once you finish checking through everything and you identify the medications that you're going to administer, just as we've all looked at, now you can now go and then prepare the medications. Preparing means that look at the medication locker and then put them in a container, the medicine pot, and then bring it back to your patient so that you can administer it to your patient. So that is simply an overview of implementation. I hope we followed and it makes some sense. Can I get a yes if it makes some sense to those who are following? Now, do we have an overview of how the implementation is about or how to go about with the implementation? There are some few technical details that we've not discussed because of time, but this is just an overview of how to go about with the implementation. If you have understood, give me a thumbs up or a yes in the comment section. If you have understood, give me a thumbs up or a yes in the comment section. If you have understood the implementation station, give me a yes, or if you haven't, just let me know in the comment section. Okay, good. Now, the last station in the API stations is the evaluation. So with that, let's also look at the scenario and how the scenario is going to be given during the evaluation station. So the main purpose for this live session, like I said earlier, is that I wish I had someone to walk me through these overviews so that at least I will have an idea how the OSCE is going to be assessed during my time when I was preparing for the OSCE. And so that is the main reason why we are here on the live session, for you to have an idea what to expect for your OSCE and then to motivate you to get yourself ready for the OSCE, because it is not difficult as it has been projected. Right, so the evaluation, this is how it's also going to be given similarly. So Mike Bell, the scenario. So if you can read the one so this document must be completed using a blue pen. If you have noticed, every station has got a different pen. It means they don't want you to make corrections at some point. So you are going to be given different pens for every station. Now, this document must be completed using a blue pen. At this station, you should have access to your assessments, your planning, and then your implementation documentation. So you're going to have access to your assessment sheets, the scenario. You will have access to your planning. It will be given back to you, and then the implementation as well. And then, because you're going to need them, so let's read a scenario. Mike Bell is being transferred to the discharge lounge ahead of his discharge home later this evening. His pneumonia is being treated conservatively. So Mike's most recent set of observations are as follows. The new score is 0. Now, the most important part of this scenario is the statement that has been written beneath the scenario. And it states that using the situation background assessment and recommendation tool, please make notes regarding your patients and use this to verbally hand information over to the doctor overseeing Mike's care, that is the examiner. So the examiner is now going to act as your doctor or as the patient's doctor. So you need to hand over the patient's care to the examiner. This is a verbally assessed station. You will have the opportunity to make notes to support your answer, and you only have 8 minutes. So the evaluation, what that you need to do is follow the situation, background, assessment, and recommendation tool. What is the situation? The situation is who your patient is and why you are calling the doctor. So that's the situation at hand. So if you are calling, you call and then you tell the doctor, this is the reason why I'm calling you. So you call and maybe you say that, hi, good evening, who am I speaking with? This is Nesima. And then they will tell you, oh, you are speaking with this doctor. Okay, doctor, I'm calling with regards to this particular patient. So in this case, you are calling with regards to Mike Bell. And Mike Bell is being transferred to the discharge lounge ahead of the discharge home later this evening. So that is the particular situation. That is the particular situation why you've called the doctor. So you explain the situation to the doctor. Now the background simply means that what is the background information of this patient? So if you remember, the reason why they will give back the assessment scenario to you. Now you need to go back, look at the presenting complaints, look at the background, and then read it out to the doctor. That this is the patient, this is the background information, this is the drug history, this is the patient's allergies. So that is the background. Now for the assessments, you are now going to tell the doctor that, okay, when Mike came, the observations that we did or the vital signs that we did, in this case, the vital signs are the vital signs that you did on the assessment. When you were doing the A to E assessment, that vital signs is what you're going to read to the assessor. And you are going to compare it to this vital signs that has been given, the recent one. So you just want to tell the assessor that, okay, when Mike came, Mike had these observations, but now that Mike is due for discharge, Mike has got these vital signs. And then you tell the assessor that, okay, when Mike came, Mike had this complaints, and this is what we did for Mike. So that is under the assessment. Now the recommendation, you are now going to tell the assessor what you are going to recommend for them to do. So even if during your planning, you did some recommendations, you are now going to tell the doctor that, oh, we did assessment, pain assessment for Mike, and we referred Mike to the pain assessment team. So can you do a follow-up? So you are recommending for them to do a follow-up on maybe the pain assessment team. And if there is anything that you want to also recommend to Mike and to the doctor, then you can also do same. So that is simply the evaluation station. It's a verbally assessed station. So you just have to talk within 8 minutes and then relay all this information to the assessor. So that is also evaluation. Any questions on evaluation, or have we understood the overview of evaluation? If you have, do type a yes in the comment section. If you have understood the API stations. Can I get a yes in the comment section if you have understood the evaluation station? Or is anyone confused? That is evaluation, just handing over a care. So this time around is a doctor You may also get a point where you need to hand over to a colleague. So you just welcome your colleague and then you tell them that, oh, this is Mike. Mike has been here and he's been discharged. So Mike is currently going home and we need to maybe compare this assessment that we did, and now this is the assessment that we have. And so if Mike is going back, then this is what we need to do for Mike. That's it. Can you please come again with the evaluation? So the evaluation, like I said, is handing over your patient's care to either a doctor or to a colleague. To either a doctor or to a colleague, as it has been stated in the scenario, and you have been given an acronym SBAR to use in handing over. The S is the situation. Why are you calling, or why are you doing the handing over? That situation is always going to be in the scenario. So even if you forget to just read what is in the scenario. And then the background is you going back to what has been stated in the assessment station. You remember the scenario that you were given. All the information there, read it out to the person receiving the handing over. And then the assessment, compare the vital signs that you did when the patient came in, compare it to the ones that has been given to you in the chart or in the scenario. Then the recommendation is recommend what they can do based on what you refer the patient to when you're writing your planning. So that's simply evaluation. Right, for those who have joined us on TikTok, if you can follow the page, we would sincerely appreciate it. I can see a lot of you are on, but most of you, 90%, have not followed the page yet. So do well to follow the page. This is what we discuss, and so that you can also be informed. So if you do have not followed me yet, and for those on YouTube as well, please do well to follow or subscribe to the YouTube channel. If you know any colleague who would also benefit from these discussions, do well to share my page to them as well. Right. So now we have covered the API stations. Now we have covered the API stations. We've covered the API stations. What we're going to do now is to look at, for those who joined from the beginning of the live session, we said that, or you were asked to write 1 to 10. That is the 10 stations. So how the nurse associates give recommendations during the handover when there is no planning in a task. That's a good question. So during your assessment, whatever you did for your patient, if you assess the pain of your patient, if you ask your patient to assume a comfortable position, if you encourage your patient to do deep breathing exercise, or if you inform your patient to do anything that helped your patients during the assessment, that is what you are going to recommend for them to do. And don't forget that during your assessment, yes, so that's simply what you're going to do. How will the nurse give recommendations? Don't forget that when you are doing assessment 2, it will get to a point where you need to refer your patients either to the social care, to the pain management team and all that. Yes, you can also refer your patient or the doctor. You can recommend for the doctor to do a follow-up on that. We are still encouraging those on TikTok do well to please follow the TikTok page, as well as those on YouTube. Do well to also subscribe to the channel. Now, those who joined earlier, we were informed for us to write 1 to 10. That is the 10 stations that you are going to be assessed on your OSCE day. And now we've done the first 4 stations, which is the API stations. Now we're going to look at the 5, 6, 7, 8. We're going to look at the 5, 6, 7, 8. So we're going to look at the OSCE timing stations. which we started looking at, so that we will know how many other 4 additional clinical skills will be required of us to learn and to prepare for, because those 4 can be selected from anywhere. Those 4 can be selected from anywhere. So now let's begin with midwifery. We're looking at the 4 additional stations that the midwives could be assessed on, making, sorry, so 4 stations the midwives could be assessed on, in addition to the API stations. That's what we are looking at now. So if you are looking at the screen, you can see that we have the, 1 minute. So if you're looking at the screen, you can see that the skills, midwifery, we've got shoulder dystocia, we've got postpartum hemorrhage birth scenario 2, there's a birth scenario 1, and then we've got birth, we've got complex birth, we've got postnatal care, postnatal check, intravenous flush and IV infusion phlebitis, IM injection, removal of urinary catheter, systematic physical examination of the newborn, and then the neonatal assessment. So those are the number of skills that you need to prepare for as a midwife, and you will be given, or they will select 4 stations or 4 skills from here for you to perform, in addition to the API stations. So this one, it will be selected based on the scenario that you get for the API. So based on the scenario, or based on the condition that you get for the API, you are going to be given 4 out of these skills stations that we are looking at to make 8. Do we get it? Does it make sense? If it makes sense, type yes in the comment section for me. If it makes sense, type yes in the comment section. If it makes sense, type yes in the comment section. We said that you are going to be assessed on 10 stations, and we've covered the API stations. And so the API stations make 4 stations. So we need to add additional 6 stations, and we were told to write professional values as number 9 and then 10 as evidence-based. So we are now only paying attention to the middle 4. Okay, so now it makes sense. Midwives, you need to prepare on 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Right, so from these 12 clinical skills, you need to master all these 12, because on your OSCE day, you'll be given 4 additional stations from here, in addition to the API stations. Right, so that is for midwives. Let's look at the nursing associates. Right, so for nursing associates, if you remember, we mentioned that they are not going to do planning, but they will do assessment, implementation, and then evaluation. And so they will have additional 5 skills or clinical skills station, together with the assessment, implementation, and then evaluation, making 8. We will later come back to the evidence base and then the professional values. So, administration of inhaled medication, fluid balance, pressure area assessment, pain assessment, hospital admission. These are 5 additional stations that nursing associates need to master. So they need to cover all these stations. These ones, they don't have options of which one is going to be selected. They are all coming. They are all coming. Okay. I hope nursing associates on here and they do understand. So now let's move on to the adult nursing. For adult nursing, these are all the clinical skill stations that you need to know. And you are only going to get 4 out of all of these clinical stations. So you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I think you have 21 or 22 clinical skill stations that you need to learn and master each one of them. And out of all of these, you're going to get 4 from there, in addition to the API stations, now making 8 stations. So administration of inhaled medication, administration of suppository, anti-embolism stockings, blood glucose monitoring, bowel assessment, catheter specimen of urine collection, fine bone gastric tube, fluid balance, IM injection, IV flash, nutrition assessment, oral care plan, oxygen therapy, pain assessment, peak expiratory flow rate, preoperative check, pressure area assessment, removal of urinary catheter, subcutaneous injection, MSU, and urinalysis, and then wound assessment and aseptic non-touch technique. So out of all these 21 or 22 stations, you are going to get 4 from here, in addition to the 4 API stations, making 8 in total. Are we following? If you are following, type a yes in the comment section if you are following. If you are following, type a yes. And if you understand, type a yes in the comment section, both on TikTok and on YouTube. Good. So now for mental health nursing, you are also going to get 4 stations from here: de-escalation, nutrition assessment, reminiscence therapy, talking therapies, physiological observations, and then intramuscular injection. So you are going to get 4 stations from there, in addition to the 4 API stations, making 8 stations. So now we know these are the total number of stations that we are going to be assessed on. Now, the last discussion we're going to have is going to be on the professional values and then the evidence-based practice. So I'm going to give an overview of the professional values, and then we look at an overview of the evidence-based practice, and that will sum up all the 10 stations that we are going to be assessed on our OSCE day. And right after that, if there are any specific questions, we will do Q&A. Right, so for professional values, this is what you need to know. You are going to be given a scenario, and based on the scenario, you would need to tell the NMC what you are going to do as a nurse in such situation. What you're going to do as a nurse in such situation. But you're going to write, or you're going to put it into writing. So let's pick one of the scenarios. Let's see, all right, so let's take this one. So false representation, or should we do false observation? Okay, falsifying observations. Let's do this one. During a night shift, one of the patients was ringing a call bell. When you attended to her, she said that she is having difficulty of breathing, and you also noticed that her right face looks a bit droopy. You checked her vital signs and have the results as follows. So BP is 200, 120, pulse is 98, respiratory rate is 26, and then the oxygen saturation is 92%, and the temperature is 37 degrees Celsius. After taking observations, she informed you that she was never assessed using the same equipment that you have used to check her vitals. The other patients in the room also commented that he was not assessed as well. So this implies that because it was maybe during a night shift, the colleague who was supposed to, so let's read the next one. Using your knowledge, the NMC 2028, the code, professional standards of practice, and then the behavior for nurses, midwives, and nursing associates. Consider the professional, ethical, and legal implications of this situation. So please summarize the actions you will take in the number of bullet points. This is a silent station, so please write clearly and legibly. What this simply means is that during the time that patients' observations were expected to be checked, it wasn't checked. It wasn't checked. So it means that you need to now at least go back and check the observations. And now you've done that. You've realized that no, the BP is way higher because probably the person who came earlier had not done these observations, had then falsified that observations. So what are you going to do in this situation? What are you going to do in this situation? Can I hear your views? What will you do in this situation? What are you going to do in this situation? Anyone? So if you were a nurse on duty and then you realize that the last person who was supposed to check the patient vitals, they failed to check it, but then they've completed their documentation stating that they did the patient's observations. What will you do in such situation? What will you do? Anyone? Those on TikTok and those on YouTube, what will you do? Flag the concern. Good. What else? What else would you do? What else would you do? I will reassure him and escalate the situation to the team leader or manager. Good. Who else? What are you going to do? Immediately check the patient vital signs again. Good. Right. So it means that at least we are not going to just ignore the patient's care and then feel like, oh, once my colleague failed to do that, I'm also going to fail to do the same. So this is what one of the things that we use to prepare our candidates. You are going to write it or put it into writing. So when we finish using this, we will go back to the marking criteria to read it as well. So you need to recognize that forcing observation or falsifying observations will put the patient's safety at risk. So this is one of the statements or one of the sentences or one of the points that you can state, that falsifying observations will put the patient's safety at risk. And then you need to acknowledge that you are going to acknowledge the professional duty to report dishonest behavior and do reassessment of the observations, just as you highlighted in the comment section. And then you're going to escalate to the manager ASAP, as soon as possible, verbally or in a written format. And then you need to also document it in the incident report book as well. And then you will ensure that you uphold the NMC code of practice or code of standards. And then you are also going to make sure to highlight that that doesn't promote truth and honesty that is set out by the UK or by the code of standards. So this is a quick way of knowing how to approach each of the scenarios. Now let's see what the marking criteria is going to expect. Marking criteria, 1 minute. So you don't know the number of, you are just going to have one of the professional values, just one. So one scenario is what you're going to have. So let's check what the marking criteria says. Falsifying observations. Right. So this is what is expected of you to write. So first, recognize that your colleague has deliberately misinterpreted the care given by falsifying vital observations. You are not expected to write this word by word, but you need to communicate what is communicated in each of the points here. And then identify the need for immediate action to assess the patient vital signs to ensure patient safety, just as you highlighted. And then document events, actions, and consequences in the patient records and complete an incident report. And also acknowledges their professional duty to report colleagues' dishonest behavior to their manager, which may result in notification to the nursing and midwifery council. Failure to report these concerns may bring their own fitness to practice into question and place their own registration at risk. This is referring to duty of conduct. And then report concerns to the manager at the earliest opportunity, verbally and in written format. Recognizes the need to be clear, honest, and objective about the reasons for concern. So anyhow that you're going to write these points, but then you're going to communicate exactly what these points means. Recognizes that the fundamental tenets of a nursing profession are truth and honesty, and that this behavior does not promote the standards and values set out in the code of promoting professionalism and trust. So this is what the expectation is in terms of you answering that kind of question. So you need to write at least 6 of these bullet points to answer that professional values question. So let's look at the evidence-based practice. Let's look at the evidence-based practice. I hope the professional values. Is it okay to mix the points up? Yes, definitely you can mix them up. Definitely you can mix them up. Let's look at uh, 1 minute. Just looking for this document. Okay. So let's look at one of the scenarios for the evidence-based practice. Right, so this is ankle sprain. So evidence-based practice, if I'm giving an overview of what it is, for evidence-based practice, you'll be given a scenario like this. and you'll be given the research findings from literature articles or studies. And you are expected to use the literature findings to now educate your patient. And so, reading from this scenario, you are the nurse who is looking after Mr. Forrest, who came into A to E due to ankle sprain following a sports activity. He asked you that he is in a lot of pain. You offered paracetamol as you can prescribe it as PGD, patient's directive. Mr. Forrest has asked you if paracetamol will do something for his pain than NSAID, which is ibuprofen. Now, these are the findings, or these are the literature evidence that you have so far. Paracetamol and ibuprofen are commonly used as analgesics, but it remains unknown if either one or the combination of both is superior for pain control. So these are the summary of the research. In one of the journals, it was proven that there was no difference in analgesic effects or side effects observed using oral paracetamol, ibuprofen, or a combination of both in patients with mild to moderate pain after soft tissue. So this is one of the findings from a research evidence. Another finding says that in a similar research, ibuprofen and paracetamol had the same effect on patient reduction of ankle sprains, but more acute ankle edema was present and other side effects in patients who were treated with ibuprofen than in patients who were treated in paracetamol. So there's also another findings. The third one, in the current available research, prescribing ibuprofen to patients is safe. However, it can cause bronchospasms and trigger asthma exacerbations. Presumably, by increasing leukotriene production due to cyclooxygenase isoenzyme inhibition. In addition, ibuprofen use accounts for an estimated 15% of all cases of drug-induced acute and renal acute. So this is all just information. So in conclusion, doctors prefer to prescribe ibuprofen or NSAIDs than paracetamol, even though there is no significant evidence that ibuprofen is superior than paracetamol. However, these are both equally effective medication for ankle sprain. So you are expected to now use these following bullet points to now educate your patient. Let your patient know why, because your patient is saying that Mr. First has asked you if paracetamol would do something for his pain than ibuprofen. So you are going to use this evidence to now educate your patient. Let's go back to the marking criteria, to what the expectation is. It is very easy. Just paraphrase these findings in your own words and include the patient's name as if you are talking to your patient face to face. That's all that you are being asked to do. Let's look at the marking criteria. And in the marking criteria, we are looking at ankle sprain. Right, so this is it. Informs, so the XI is the patient's name. So let's say inform Mike that both paracetamol and ibuprofen are equally effective analgesics. This is what's expected of you to write. And then I will explain to Mike that some clinicians prefer to prescribe ibuprofen, but there is no clear evidence that it is superior. I will also advise Mike that the current available research suggests that paracetamol is an effective analgesic for pain resulting from soft tissue injuries. And then I will explain to Mike that although ibuprofen is safe, it can have more adverse effects and can be contraindicated in patients who have bronchospasms, cardiac, and renal failure. And then the last one, I recognize that. So I recognize that Mike is asthmatic and advises that paracetamol would be more suitable. So these are the bullet points that you are expected to cover for ankle sprain as evidence-based practice scenario. So I hope we do follow and we do understand evidence-based practice and professional values. If we do understand, please type yes in the comment section. If we do understand, please type yes in the comment section. If you were following, please type yes in the comment section. And I hope it makes sense. So don't forget that when you go back, yes, but confusing, right? Probably maybe because you are on TikTok. So when you go back to watch this video, or when you go back to the NMC website to download the study materials, look at the OSCE timing stations, and know that professional values, you're going to get one scenario. Evidence-based practice, you're going to get one scenario, one from each. So now let's quickly look at that of the midwifery. So midwifery, you're going to get one evidence-based, which is either going to be place of birth, induction of labor at term, and then smoking and pregnancy. You're going to get one from there. Then professional values, you are either going to get bereavement care, safeguarding women and children. So you're going to get one of these scenarios. Let's look at the nursing associates. Nursing associates, you're going to get diabetes for the evidence-based practice, and professional values, you're going to get confidentiality. So that is that for nursing associates. So these are all the 10 stations nursing associates are going to prepare for. And then for adult nursing, for the evidence-based, these are all the evidence-based scenarios, and you're going to get one from this list. It's a lot of them. And then the professional values, you're going to get one from this list. A lot of them as well. The same as mental health nurses, you're going to get one from here, and then you're going to get one from here. So I believe now, if you have been part of the discussion from when we started, you have an overview of what you should expect and how your OSCE exam is going to be assessed from the API stations to the clinical stations, now to the professional values, and then the evidence-based practice scenarios. Everyone is going to be assessed on 10 stations. And for the 10 stations, 4 stations for the API stations, nursing associates will be having 3 stations for the AI stations, and then 4 additional stations, that's the clinical stations, to the API stations, and then 5 additional stations to the AI stations to the nursing associates, and then 1 professional value, and then 1 evidence-based practice for each one of these specialty. So this is where we bring our discussion to a close and then open up for any questions that you may have. So if you have any specific questions, I am happy to answer them for you. If you have any specific questions, I am happy to answer them for you. So you can request to join me on either TikTok, and then I'll be glad to answer all your questions. So any questions? Now, I believe you don't have to be thinking so loud on whether you need to begin your OSCE preparation or not. This should give you at least a fair idea of what the OSCE will look like and then how to prepare. So we are going to begin our next class on Monday, which is going to be on the 3rd of August, 8:30 in the evening to 10:30 in the evening, around the same time, and we are about to close. If the time does not work for you, you just have to communicate your time to us, and we will find an appropriate time to make sure that you do not miss out on all the stations or all the class. The goal is to make sure that we cover every station with every individual. At the moment, we offer training for the adult nurse and nursing associate midwives. And so if you are happy, what you need to do is just send a DM to me right after the live. I am going to respond to you. Let me see if I can change this, so that for those on TikTok, you will be able to eventually you will be able to contact us on the number that is going to be shown. Right. So if there are any questions, please do well to ask. I will be happy to answer any questions that you have. And I hope it has been useful. If it has, kindly type yes in the comment section. If it has been useful, do type yes in the comment section. Very useful. Right. Glad to hear that. Are there any questions at all? Instead of adults, please, you're trying to register at the Leeds Center, but are you able to come again with your question, Sawa? Are you able to come again with your question? Right, so for those who are interested to join in the class, you may want to contact us using the number you are seeing on the flyer. Yes, we do one-on-one, depending on your situation. We do one-on-one session. Thank you. We do one-on-one session depending on your situation. So you can contact us. But unfortunately, we do not do the face-to-face session. Yeah, fortunately, we do not do the face-to-face session. Right, so I think I am happy to end the YouTube live now. We've passed 3 hours. And so for those who are on here with me, please do want to join me on TikTok so that we can finish up on TikTok. Thank you once again for joining and being part of this live session.